Doctor, National Computer Systems offers a well-recognized computerized scoring system for the MCMI, correct?
Correct.
I would like you to consider the disclaimer prefacing all computerized interpretations of the MCMI-2, written by National Computer Systems. And I'll read, quote, "The MCMI reports are normed on patients who were in the early phases of assessment or psychotherapy because of emotional discomforts or social difficulties. Respondents who did not fit this normative population or who have inappropriately taken the MCMI for non-clinical purposes may have distorted reports," unquote. Now my question. Unless someone is in the early phases of assessment or psychotherapy because of emotional discomforts or social difficulties, it is inappropriate to use the Millon Clinical Multiaxial Inventory with that person, correct?
Well, in terms of the computerized interpretation, it may be inappropriate.
And the disclaimer continues, to optimize clinical utility, the report highlights pathological characteristics and dynamics rather than strengths and positive attributes, unquote. Now, my question. If the Millon Clinical Multiaxial Inventory highlights pathological characteristics rather than strengths and positive attributes, if a person taking the MCMI can be characterized as drawn from a normal population, you're relying on the MCMI in this case could misinform and mislead this proceeding, correct?
It could, discounting my own clinical judgment, yes.
Okay, and the disclaimer in the manual published by the National Computer Systems further says, quote, "This focus should be kept in mind by the referring clinician reading the report," unquote. Now my question. You would agree with this portion of the test publisher's disclaimer, correct?
Yes.
If the examinee in this case does not necessarily exhibit emotional discomforts and social difficulties, then the use of the MCMI-2 would be inappropriate, correct?
It could be.
And using the MCMI to assess someone who does not necessarily exhibit emotional discomforts and social difficulties is inappropriate because the MCMI, quote, highlights pathological characteristics and dynamics rather than strengths and positive attributes, correct?
That's true of the computerized narrative.
Thank you. Therefore, using the MCMI with someone who does not necessarily exhibit, quote, emotional discomforts and social difficulties, unquote, could lead to overdiagnosis of psychopathology, correct?
Yes, if one over-relies on the computerized narrative.
Thank you. Now, the Journal of Personality Assessment is a generally recognized and accepted peer-reviewed journal in your field, correct?
Yes.
And a 1996 article by Retzloff, published in the Journal of Personality Assessment, titled MCMI-2 Validity, Bad Test or Bad Validity, unquote, might be relevant to your opinions in this case, correct?
It could be.
The positive predictive power of any test corresponds to whether an elevated score accurately identifies a particular disorder, correct?
Yes.
Would it surprise you to know that Retzloff reported the positive predictive power of the MCMI for identifying various personality disorders ranged from 0.07 to 0.32?
Yes, that would surprise me.
A range of positive predictive power from 0.07 to 0.32 is pretty low, isn't it, Doctor?
Yes.
In fact, flipping a coin would give us 0.5, wouldn't it?
Yes.
Would it surprise you to know that in his 1996 article, Retzloff also reported that elevated MCMI scores result in mistaken diagnosis in more than 4 out of 5 cases?
Yes, I find that very surprising.
That is surprising, isn't it? In other words, the rate of classification error when relying on elevated MCMI scores to identify personality disorders exceeds 80%, correct?
According to that data that you're citing.
And you have not published anything in a peer-reviewed journal necessitating that we reconsider Retzloff's findings, correct?
No.
And you cannot cite anything published in a peer-reviewed journal necessitating that we reconsider Retzloff's findings, can you, Doctor?
No.
Now, the journal Law and Human Behavior is also a generally recognized and accepted peer-reviewed journal in your field, correct?
Yes, it is.
And a 1999 article by Rogers and his colleagues published in Law and Human Behavior titled Validation of the Millon Clinical Multiaxial Inventory for Axis II Disorders, Does It Meet the Dauber Standard, unquote, might be relevant to your opinions in this case, correct?
It could be.
And in this 1999 article in Law and Human Behavior, Rogers and his colleagues wrote, in the current paper, we first examined the scientific evidence for the validity of the most current version, MCMI3, for Axis II disorders and found it markedly deficient with respect to both criterion-related and construct validity, unquote. Now my question. Axis II disorders refer to DSM-4 classification's personality disorders, correct?
Correct.
And if the criterion-related and the construct validity of the MCMI are deficient for the identification of Axis II disorders, then you're relying on the MCMI3, in this case, could misinform and mislead this proceeding, correct?
If that's the case, yes.
You have not published anything in a peer-reviewed journal necessitating that we reconsider the 1999 position of Rogers and his colleagues regarding the MCMI3, have you?
No.
And you cannot cite anything published in a peer-reviewed journal necessitating that we reconsider the 1999 position of Rogers and his colleagues regarding the MCMI3, correct?
No, but I can tell you that many of my colleagues, including myself,
Thank you, but you have
rely
not,
on.
and you cannot cite, as you sit here today, anything published in a peer-reviewed journal necessitating that we reconsider the 1999 position of Rogers and his colleagues, correct?
No.
Thank you, Doctor.